Orlando. Thanks for watching. Let's talk about Protonix or pantoprazole. This is a proton pump inhibitor for heartburn, gastroesophageal reflux disease. It was discovered in 1985, approved by the FDA in the year 2000. It's in the top 25 drugs prescribed in the United States, with millions and millions of people taking the drug. In the United States, it is a prescription drug. It is over the counter in the United Kingdom. Heartburn therapy is big business. It's estimated that 7 to 14% of people over age 60 are taking these kind of drugs. And that number's increased by about fourfold over the past 10 years. And it's often due to people who just start the drug and continue to take the drug, whether they need it or not. Seems that we spend billions of dollars on these kind of therapies, second only to the amount of money we spend on the lipid-reducing medicines. And interestingly, it appears that about 60% of people taking the proton pump inhibitors take them for inappropriate reasons. The proton pump inhibitors marketed at the present time in the United States are the Protonix, there's Prilosec or omeprazole, there's Nexium, there's Prevacid, Dexilent, and Acifex. Seems that the effectiveness of all of the drugs is pretty much the same. The indication specifically for Protonix, it's for the short-term treatment of erosive esophagitis associated with the symptoms of GERD, gastroesophageal reflux disease, heartburn, and for the maintenance of the healing of the esophagitis. And it also is appropriate for those people who suffer from a very rare condition of pathologic hypersecretion of stomach acid. It's known as the Zollinger-Ellison syndrome. Now, typically, it's taken for a lot of other reasons. So it's taken by a lot of people just because they have GERD or heartburn, even though they don't have any esophageal erosions. It's taken by people who have peptic ulcer disease, who have had a history of peptic ulcer, or have had a history of gastrointestinal bleeding. It's part of the 4-part therapy for treating Helicobacter pylori. It's used to prevent gastric ulcer in people who are taking the non-steroidal anti-inflammatories, the Motrin and ibuprofen and naproxen and diclofenac. It's used in the people who are taking the antiplatelet or the anticoagulant drugs, especially if they're over age 65, to help protect the stomach. Used in people who are taking prednisone or cortisone, and people who have dysphagia, difficulty swallowing because of the acid reflux. So if we look at esophageal erosions, the condition known as erosive esophagitis, the healing rate is going to be about 75% after 1 month of one-a-day therapy. 40 milligrams once a day. 75% of the people are going to be healed by 2 months. Over 90% of the people are going to be healed. That compares to 14% and 40% with placebo. The 40 milligram dose seems to be a lot better than the 20 milligram dose. It seems that we can get complete remission of both the daytime and the nighttime heartburn, the absence of regurgitation in many people, and it starts on day number 1. And it's certainly better than the H2 blockers like cimetidine or ranitidine. If we compare the pantoprazole or the Protonix, and we compare that to, let's say, Acid, well, the healing with 4 weeks and 8 weeks of the Protonix, going to be 64 and about 85% versus 22 and 40% with the Acid. And if we look at the maintenance of healing, let's say comparing it now to ranitidine, well, at month 1, let's say there's about 99% healing with the Protonix versus about 70% with the ranitidine. After 6 months, still about 90% with the Protonix versus only about 45% with the ranitidine. After a year, it's still about 85–90% with the Protonix versus only about 35% with the ranitidine. So significantly better. Now, just because you take the drug doesn't necessarily mean you can completely get rid of the heartburn, and indeed you cannot. So in many people, there will be episodes both daytime and nighttime. There are just going to be a lot fewer episodes compared to taking other medicines. And over a period of time, as you take the drug for a longer period, up to about 6 months, it seems that the drug seems to work even better as opposed to, say, some of those H2 blockers like the cimetidine or the ranitidine or the Acid that seem to have some deterioration in their benefit. Now, as I mentioned, all of the drugs in the proton pump inhibitor family are basically the same, but some people seem to respond better to one drug than another, even though they all seem to heal the erosive esophagitis by somewhere around 90 to 95%. Now, the drug is often used as a diagnostic test. So if you think you have gastroesophageal reflux disease and take the medicine, and the symptoms go away by about 50%, then you can say, well, geez, I think probably that's what I had. Well, unfortunately, it's not specific, because you could also have functional dyspepsia, you could have a gastric ulcer, it could be a placebo effect. And just because the symptoms don't go away doesn't mean you don't have gastroesophageal reflux disease, because you might not be taking it right, or you might have non-acid reflux. Another problem is that if you take the medicine and it either doesn't work or you get recurrence very early or relapse, well, it might be that you have a different kind of problem. You could even have gastric cancer. So the drug is best taken after a prolonged fast. Take it before breakfast. Take about 30 minutes before your breakfast. That allows it sufficient amount of time to concentrate in the parietal cells. That's the area in the stomach that makes the acid. And even if your symptoms are most prevalent during the evening hours, you still take it before breakfast. It can be taken with food. It just doesn't work nearly as well if you take it with food. You swallow the pill whole. You don't split it or crush it or chew it. If you use the suspension, well, you can add it to a little apple juice and take it immediately, or applesauce and take it within 10 minutes, but don't add it to any other liquid or any other food. You could take it with an acid if you want. It seems that the short-term erosive esophagitis, the dose is going to be about 40 milligrams once a day for up to 8 weeks. It's okay for children over 30 pounds at that dose. Maintenance of healing is 40 milligrams a day. It's only been studied for up to a year. In people who have the hypersecretory state, the Zollinger-Ellison syndrome, you can take a whole lot of the medicine. A typical dose would be starting as low as 40 milligrams twice a day, but going all the way up to 240 milligrams a day. It's considered safe, but if you take it for long enough, you might have some unintended consequences. So if you take the drug, as with any drug, it could be associated with nausea or vomiting or diarrhea or headache or abdominal pain or maybe some gas and dizziness. But it could be associated with allergic reactions or swelling of the face or sensitivity to the sunlight, or dry mouth, or aches and pains in the muscles and joints, sometimes blurred vision, and even some liver abnormalities. Now, one of the things that it can do is it can lead to an increase in a bacteria known as Clostridium difficile. And Clostridium difficile, when it grows in the intestinal tract, may cause a horrible diarrhea, and in some cases may lead to death. And it seems that since the stomach acid kills a lot of the bacteria, if we eliminate the acidity of the stomach, then those bacteria can thrive, especially if a person is immunocompromised or elderly or hospitalized or taking a broad spectrum antibiotic. And since the purpose of the acidity, one of the purposes of the acidity, is to kill the bacteria, well, sometimes you can aspirate small amounts of gastrointestinal contents into the lung, and that increases the likelihood of community-acquired pneumonia, just because you happen to be taking Protonix. And that's especially if you have a history of asthma or some lung disease, chronic lung disease, or HIV or diabetes, or if you have some other condition that might affect the white cells. And as a matter of fact, the Protonix might affect the white cells. Also decreases the absorption of iron, may lead to an iron deficiency anemia. And if you take it for more than 3 months, usually you take it for years, then it can lead to magnesium deficiency, which is important if you're taking a diuretic or a digitalis type preparation. Also can decrease the amount of absorption of potassium and calcium. That can lead to some arrhythmias or tetany or seizures. Can cause a B12 deficiency And because it can interfere with the absorption of calcium, reduce it by about 40%, that can lead to osteoporosis in the hip and the spine and other areas, and lead to an increase in osteoporotic-related fractures if you take the drug for a prolonged period of time. So you can fracture your hip or your wrist or your spine just because you're taking the drug. And if you think that the Fosamax or similar drug, the bisphosphonate, is going to help, well, the drug interferes with the function of that. And there's some kind of a link, nobody's exactly sure what it is, between the drug and Alzheimer's disease. It seems that the drug alters the metabolism of the amyloid protein and the tau protein. Maybe it's because of the B12 or something else. Seems in some studies to increase all-cause mortality, and interestingly might be associated with kidney disease, chronic kidney disease, causes a disease called acute interstitial nephritis. This can occur anytime during the course of therapy. It's idiopathic. We don't understand why people develop it. It seems to be a sensitivity reaction, could be totally asymptomatic, or you might suffer from some nausea or vomiting or fatigue or even a little fever or some red blood cells in the urine. And this can lead ultimately over a period of time to chronic kidney disease. Chronic damage is increased by about 20 to 30% among people taking the Protonix versus people taking a placebo therapy. The condition silently develops and can lead to chronic kidney disease or end-stage renal disease. Can also cause lupus. It would cause the cutaneous lupus, not the systemic lupus. It seems that it's associated with a rash, but not with organ involvement. It can be a new onset disease or exacerbation if you already had the disease. Can occur weeks or months after you've been on the medicine. Just recently we found that the drug can cause some fundic gland polyps in the stomach. This was described incidentally, just on endoscopy. It seems that the serum gastrin might increase by about 70% if you're taking the proton pump inhibitors. The gastrin is the chemical that tells the stomach glands to make the acid. Well, we don't want it to be elevated, but it's elevated by about 72%, and in some studies by as much as 300%. Well, when you stop taking the drug, most of the time, it's going to fall back to the normal zone. But in some people, it can remain elevated for months to years. No change in other hormones, no change in the thyroid or testosterone or prolactin or insulin. Some people, when they take the drug, if they have a urine test, might show positive for THC or chromogranin A. That's a hint of some sort of neuroendocrine tumor. So those are false positive tests. It also can alter the test for Helicobacter pylori, give us a false negative test. Negative stool test or negative urea breath test or negative rapid urease test on a biopsy of the stomach. The only test that stays positive is the serology. If you're going to be tested, you probably should be off the drug for about 2 weeks before the test. And it can interact with some different kind of medicines, HIV medicines and warfarin, methotrexate, cyclosporin. And it also alters drugs that require acidity in order for their absorption. So iron that we mentioned before, ketoconazole, ampicillin, and even the amphetamines that are used to treat attention deficit hyperactivity disorder. Is it safe for pregnancy? Well, at least in the animal models, it can alter the bone morphology, decrease the weight, and lead to increased fetal mortality. But we don't have any good evidence of a negative effect in humans, not used terribly commonly in pregnant women. Don't have long-term data on that. Long-term studies have not been done, but it's not recommended. Breastfeeding, it's only an extraordinarily small quantity of the medicine that reaches the breast milk, and as far as we know, has no adverse effect on the newborn child. The drug is okayed for use in children over age 1. In children less than age 1, it seems to be associated with side effects but no effectiveness. Now, interestingly, children between the ages of 1 and 5, we don't have any appropriate dose form, but it is okayed for those children. The way the medicine works is it works on the gastric acid production. It takes the last step, the parietal cell step, with the hydrogen potassium ATPase enzyme, and it stops all of that. So it limits the amount of stimulated acid and basal acid that the cells can secrete. But the cells are turning over all of the time. So you need to continue to take the drug. Well, how well does the medicine work? Well, if we took just one 40 milligram pill, it would inhibit the acid production by about 50% at 2.5 hours. If we took the drug every single day for a week, that would inhibit the acid production by about 85%. So we do get a significant reduction, and the longer you take it, seems the better it works, up to a point. Now, when you stop the medicine, it seems that the acid starts to be secreted in normal amounts within a period of about a week. You have millions of these parietal cells. They're constantly being reproduced. That's why you, number one, don't get complete suppression of the acid. And number two, you got to keep on taking the pill. Now, even though you might take the pill just in the morning, it is going to work for 24 hours. There was a time when people were taking a pill in the morning and a pill at night, but that seems to be inappropriate. The absorption of the medicine begins after it leaves the stomach. Peak absorption is about 2.5 hours after you take it. The half-life of the medicine is 1 to 2 hours. About 75–80% is going to be bioavailable, but it's bound tightly to the plasma proteins in about 95 or more percent. And that means that the bound portion is inactive. Only a small percent is active, at least that's floating around. Now, it's not altered when a person takes it with antacids. If you take it with food, you're going to delay the absorption by at least a couple hours and decrease the amount that gets into the system. And the medicine doesn't seem to work too well in the acid environment of the stomach. It's going to be metabolized by a series of different enzymes in the liver. It's going to be metabolized to certain kind of compounds, but those compounds are not going to be active. It's excreted about 70% in the urine, about 20% in the feces. If you have some mild to moderate liver impairment, it's going to increase the concentration of the Protonix by about 50%. And that means that additionally, the serum half-life is going to be about 7 to 9 hours versus the 1 to 2 hours. So that's going to give us what we call an area under the curve. The amount of medicine that's in your system is going to be increased by about 5 to 7-fold. We don't have to worry if you have renal impairment, even if it's significant. That's not going to lead to a change in the dose of the medicine. Now, at least in animal studies, and we don't know that there's translation from animal studies to human studies. It doesn't appear that there is all the time, but there seem to be some dose-related problems as far as tumors are concerned. So we have some enterochromaffin-like cell hyperplasia and benign and malignant neuroendocrine cell tumors. We have benign squamous papillomas and malignant squamous cell carcinomas in the stomach. In the duodenum, we have benign polyps and adenocarcinoma. And in the liver of these test animals, we have liver carcinoma, hepatocellular carcinoma, and adenomas, and even thyroid adenomas and thyroid carcinomas. At least in animals, taking overdoses of the medicine leads to death in mice and rats and dogs. Person has anti-reflux surgery and thinks that that's going to be an end to the story, it typically isn't. Still, at least 50% of the people are going to end up on long-term proton pump inhibitors like Protonix. Now, additionally, gastric acidity, normal gastric acidity, is important to filter out bacteria. We have a microbiome. We have our normal kind of bacteria that are in our upper intestinal tract and in our lower intestinal tract. And we've just come to realize that these bacteria are extraordinarily important not only for gastrointestinal disease, but for a variety of other medical conditions. So for instance, strep. If we have people who are taking the proton pump inhibitors, we find that they have an increased amount of strep in the stomach. That's irrespective of whether they have Helicobacter pylori or not. And this strep might explain some of the dyspeptic symptoms, some of the heartburn and indigestion that people get while they're taking the proton pump inhibitors. And it seems that people who take the proton pump inhibitors, we have a shift in the gastrointestinal microflora toward the less healthy strains of bacteria. And that's both in the stomach and in the small intestine and in the large intestine. And it seems that the proton pump inhibitors might actually be able to kill some of the bacteria, or at least be bacteriostatic. And additionally, it seems that some of the kind of bacteria that grow typically in the oropharynx, the back of the mouth, the throat, and the kind of the bacteria that grow in the large intestine, including the strep, well, they seem to be found in people taking the proton pump inhibitors in the stomach. Now, some of the altered gastrointestinal microflora might lead to irritable bowel syndrome, inflammatory bowel syndrome, lead to small intestinal bacterial overgrowth, celiac disease, colorectal carcinoma, obesity and diabetes, type 2 diabetes, to certain allergies and asthma and cardiovascular disease and neuropsychiatric disease, and even be important in the aging process. Well, it seems that these proton pump inhibitors, rather than expanding the bacterial diversity, contract it. And that's exactly what we don't want. Well, the drug is available in 20 milligram, 40 milligram doses, and it's available as an oral suspension. The drug company behind it's gotten in a fair amount of trouble over time. The feds are mad at them because they approved the drug for erosive esophagitis, and they told the drug company not to promote it for other use, but the drug company went around and started promoting it for gastroesophageal reflux and heartburn and problems like that. And then the company got in trouble with the Department of Justice because, according to the DOJ, they overcharged Medicaid for Protonix. And as a result, the government fined them almost $750 million. Well, there's big business with these medicines. What about the price? Well, it's interesting about the price. So now it's generic. So for cash, you could go over to Costco and get a month's supply of the drug for about $14. But if you happen to end up at Walgreens, it's going to cost you $105 cash. If you had a coupon, like from GoodRx, it would only cost between $3 and $21 for a month's supply. But if you wanted the brand name, if you wanted the Protonix itself, a month's supply with a coupon is going to be $420. So that's the story of Protonix. It's a good proton pump inhibitor. But unfortunately, too many people take it and they think it's just a simple pill that's going to kill their heartburn, and they don't understand the changes that are occurring in the kidney and in the colon and in the stomach and in the throat and in the lungs and all those other areas. So you have to remember that these PPIs, Protonix included, they're very important medicine. They're very strong medicine. They cause a lot of changes in the body system. So as with anything else, any other kind of medicine, take it when it's appropriate. But after it's served its purpose, stop. Anyway, thanks for watching. Hope you enjoyed the show. If you did, please tell a friend. Maybe consider subscribing to us. Subscribe to the channel. Then you'll be notified when we post new shows. Appreciate your time. I'm Dr. Ken Landau.